What's up, guys? Welcome to the third episode of the What's True Health podcast. I'm joined by Henry, and today we've
Hi
got a very
everyone.
special guest. The Daniel Arbilla is coming to join us. He's an EP from Sydney. Daniel, introduce yourself, please.
Yeah, Daniel Arbilla, as you mentioned, EP. Was lucky enough to meet Victor firstly online and then in person recently, and had a very deep and meaningful chat last week, and decided to chime in and I appreciate the invite. Hopefully, this is helpful for fellow students navigating the world, and I'm just
Daniel
like
might get
reflecting
cut
on
off a little bit there. Oh, you're
my
back
mic.
now. Yep,
I'm
you're
back.
back now.
Yeah, cool. Let me know if I get off again.
Yep,
But EP based in Sydney, helping people with pain, MSK injuries.
perfect. So, do you want to get
Sounds good.
started then on the first question?
Well, no, I think we should first ask him, where did you study? Obviously, like where
Okay,
did
yeah, a bit
you?
of background. Yes.
Yeah, bit of background.
All right.
Taking back. Let's go. 2010,
Dan, you're out of you.
2011.
Oh, you're
Am I
back.
again?
No, he's good. I
Or is it
agree.
just me?
It's just you,
Yeah.
Victor.
Oh, sorry then. My bad.
Um, 2010, 2011, I think was my first year, which is ages ago now that I think about it. Originally, we didn't have EP in USYD, and this was also in Cumberland campus. I'll try not to go
Yeah,
too
okay.
nostalgic. I'll keep it short and sweet. And so graduated 2014, went into some mobile roles, and also went back into uni, did 2.5 years of arts. I wanted to learn more about why people behave the way they behave. So I did some psychology, and never ended up deciding to go down the psychology route, but used the knowledge within EP. So 2017 started full-time work at a gym and at a private practice, uh, working as a sole EP in both places. This was still like EP is still relatively new, so I still had a bit of time to figure out like what I actually want to do and how I want to practice and what kind of EP might look like. Um,
Were you
and
working? Sorry, were you working just while you're there? Were you working with physios in a practice, or was it what sort of clinic was it?
so the commercial gym was with personal trainers, and then the physio was a physio practice, so run by
Okay,
physios.
cool. Yeah.
Maybe four other physios. Um, but full autonomy, and also didn't really have as much guidance as to how to actually practice. Um,
Okay.
and the following year, I landed a full-time role. So I was during this time, I was kind of doing what I think I see Victor doing, like being online, putting out information, and I also highly recommend any students to reach out to people on LinkedIn. So I was just cold emailing people, being really annoying, asking them questions, and that helped me land my full-time role. So this role was not advertised on Seek or anywhere, and was very lucky at that clinic. Worked there 2.5 years. Um, the team was expanding, and this was just before COVID. Now, then COVID hit. A few different circumstances, and the direction that the company was heading towards was different to the direction that I wanted to head towards. I like to expand on any of these points. I'm like fast
Yeah.
forwarding like 9 years here.
No, I agree.
And now working as a sole practitioner. So working for myself 3 days a week is in a home gym, like behind me, and mobile. And then 2 days is at Barbell Psychology, renting a studio with a psychologist. So yeah.
Okay, that's interesting.
Sounds
Yeah,
good.
cool. So, Victor, do you want to
Yeah.
ask? Go
All
for it.
right,
Go for it.
so this will be basically a Q&A style sort of podcast. So we're just going to each ask each other questions. I'll get started. So the first question, I know we've talked about this a lot, both on social media and in person, Dan, but just for everyone listening, what is an exercise physiologist and how is this different to a physiotherapist?
Yeah, it's a. I wish there was like a quick soundbite answer if this was with a client. I would be a dick and be like, I'm like a physio, but better. If this was with a family member or someone who doesn't really know, I'd be saying something along the lines of, I use exercise and movement and active strategies to help people with their health conditions. That's like the simplest form. If I was talking to like I guess another allied health professional or student, I would be emphasizing it's more about the individual than it is the profession. So what I mean is, and maybe Victor, you've seen so far with myself and shadowing another EP that we both know, um, that everyone's style is different. So you would go to a physio, and even myself, when I had injuries as a soccer player, I would go to 10 different clinicians, physios, a couple of osteos, chiros. I had my own kind of persisting injuries and pain. And literally every single one had a completely different diagnosis, had a completely different treatment style, philosophy, and different advice. So two EPs could be practicing completely different to each other. So I hesitate to have like a general statement, because then everyone thinks that everyone practices like me, which is not the case. And also, I don't want it to be the case. I think there should be different ways, different perspectives, and different approaches. And it's more dependent on where you work. And what I mean is, like, if you work with physios, or if you work with a multidisciplinary team with a dietitian in a hospital setting, or if you are working in a workers' comp, like rehab setting, and working with rehab consultants. Each of those settings, even though you are an EP and you have the same qualifications, same scope of practice, your role and how you work would be completely different. So yeah, I'm also keen to hear like what you guys have heard. So Victor's mentioned like that video from USYD that showed some of the differences with like exercise science, EP, and physio. So yeah, I hope we can bounce back and forth. So it's not just me talking the whole time. My voice gets boring. But yeah, what are your thoughts? What have you heard?
So, well, maybe before we get into that, I just want to say something. I feel like people don't realize the scope that EPs have, or at least that was from my experience when I started. I thought that EPs were, well, same as physios, they were mostly worked in a clinic, but I also knew that physios did have the opportunity to do cardiac rehab and neuro stuff. I expected them to be more wide in terms of where they could be. But now, as I explored what an EP actually is capable of doing, I realized that I feel like those boundaries are only there because of the historical context that physios have. They've been in the game longer. They've had time to go and establish those areas. Whereas EP, maybe it is newer, and these places like hospital settings, maybe we're not there yet, but we do have still the scope of practice to be able to work in there.
Yeah. Well, as Daniel said, like he was one of the first to come through as an EP, and that's 2009, right?
Yeah, and to clarify, I was the first to go through the Bachelor of EP. So before that, there was only masters in USYD.
Okay.
And yes, so I think it was 2000 and I'd have to get the date up because I asked this in our Facebook group, the ESSA New South Wales chapter, which is an awesome resource for accredited exercise physiologists. And ChatGPT came up with like 2001, but I think it's 2006. That's when I have to look up the actual exact date. That's when EP was recognized through Medicare.
Yes.
So what that meant was that was the first time EPs could see people through GP referrals. And that gave us access to NDIS, to work cover, to aged care, and to DVA, Department of Veteran Affairs. So this gave us like a power in the medical hierarchy. Before that, we were just basically the same as overqualified personal trainers. Not that there's anything wrong with being overqualified or being a personal trainer. So yeah, it's relatively new, and like you mentioned, Victor, it's there's a lot of history behind each that we don't like. I doubt you guys went through. I know I didn't went through like any history of like why EP started.
Not at all. Yeah. And like you go around and you ask. I would say even Victor, if we ask people in our cohort doing EP what they think it is, they wouldn't have a great understanding at all. And even like especially if you go and ask people who, random people, the knowledge of what it even does is definitely not well known around the whole community,
I feel
and
like
that's
that's
something
just
that
lacking in
yeah,
just
but
yeah.
it's that's something that will obviously grow the more it, and I think it is growing. Don't even, but I'm hearing more about it. Yeah, hopefully it does keep growing and we start to hear more about it. So people can sort of, in terms of client base and things like that, we need people to understand what the value is, so that EPs can be used to their best.
Yeah, absolutely. And we can work very well with other professionals as well. So yeah, I would say the other part was like the differences between EP and
Yes.
physio. So I'll go 3 levels. One level would be if I was a dick, and I'd be, again, we are like physios, but better at exercise. And that's just me being a dick because it depends. And
We've heard that
I know
one before.
physios
Yeah.
who, yeah, I know physios who are amazing at exercise prescription and have done sports science and work in an S&C kind of context. So they would have a lot more exposure and experience and networks and resources, and they're up to date with performance for specific sports. I would 100% refer on to them if I'm seeing like an elite athlete, for instance. So I wouldn't jump to that conclusion. But that's just if I was, again, being really simple. The next level would be talking to a family or a friend. Physios can diagnose and can do manual therapy and generally are better and more experienced at acute traumatic injuries. EPs were generally better and more experienced with persistent injuries, persistent pain, chronic conditions, and illnesses. So I see those two like overlapping.
Mm-hmm.
Do you think if EPs were given the power to, and like that this is included in the course, to diagnose, and that sort of level goes up, do you think EPs would become more sort of well known and
Good question.
more, because that's one thing many people are talking about in terms of the medical hierarchy. That's where physios take that step up and they have their sort of extra powers, sort of not powers, but
Yeah, I mean, but power is important because the by power within medico-legal terms, it means if you injure yourself at work, say you get a slip, and you injured your knee and you've got some ligament damage. If you go to an EP, they can't give you an official diagnosis. So you go back to your worker, your employer, and they're like, this is I need an actual diagnosis. So they would need to go to a physio. So there's power in the access to treatments, even though theoretically the EP and the physio would be doing exactly the same thing. So the diagnosis is the power for more treatments or the access to different specialists, for instance.
okay.
I would say if I was to say between yes and no, I would say yes. It would provide more power within the medical hierarchy. Whether or not it would change treatment is a different question.
Then that raises the question, why would, well, we know that EP came as a result from the increasing burden of chronic disease, right? Whoever made the degree, why wouldn't they include those other things like diagnosis, like manual therapy? Why, yeah, the question becomes, why is this not included, even though it's a more new degree?
Good question. And I think
Yeah, that is a good question.
there's been talk of expanding our scope of practice as EPs to include diagnosis. So like this podcast episode, this discussion might be outdated next year or the year after. Who knows? I don't know.
That's true.
At the same time, to answer your question, we would need to dive into the history and the political power that each profession holds within the medical board. So it would depend on who decides. Who decides what our scope of practice is?
Okay.
We'd have to go up higher into policy, into public
Yeah.
policy, into health policy. So yeah, that I would go there.
So you think
That's my way of saying I don't know. I would have to go there. Ask there.
so you think there's a lot more political and government involvement in that question? and
Oh,
people maybe
yeah.
butting heads in certain areas.
Yeah, yeah. And I would butt heads if I was, say, I had decision-making power in a physio association, because it would mean it would take my work. It would take some of my power, and it makes complete sense. So yeah, again, I can't make any claims because I don't know enough. We'd have to talk to someone who's in ESSA, and I'm
Yeah.
sure these discussions have been had and are continually being done, because when it comes to musculoskeletal injuries and pain, the literature has changed so much since even that Medicare year, say the mid 2000s. What we know about pain and injury now, almost 20 years later, is completely different. So if we're still doing the same shit that we are in the 2000s as well, this decade, we're falling behind. So I think over time it will evolve, and yeah, maybe even there's talk about merging in the future if we become like a musculoskeletal therapist. So chiro and osteos are the other ones involved here.
Definitely. I think that's great. We uncovered some great answers for students who maybe they're doing the degree and they don't know exactly what they're getting into, what are the underlying maybe
Yeah,
bodies that.
like I feel
Sorry.
like these levels of degrees, like physio, EPs, they definitely are dictated by universities as well as government. Like, Sydney Uni, for example, glorifies physio. Like as a 99 ATAR, it's seen as, it's that's the spot to be. That's other than medicine, that's the degree to go for. And I guess I guess the importance of EP, because EP is again another step above exercise science, as in the ATAR's 91 for EP
Well,
muscle
the
exercise.
ATAR is
It's sort of
I've heard the ATAR is a reflection of the demand for a course, right? So
yeah,
what I've heard
yeah,
is a lot of med students that maybe they don't get into med, they want to do something that's almost like med or in that sphere. So they do physio, and that might be a part that's contributing to the inflated ATAR. But maybe because
yeah.
they're just not aware of EP, it hasn't affected it in the same way.
Yeah, well, it doesn't have the same stature.
Yeah.
Would you say medicine is the same workload as physio?
Same
Because they got the
workload.
same ATAR.
Oof.
So
Yeah,
if you're putting it on a scale like that,
it's tough, and it's like
there
at
are
least
other
an extra
entries that
3 years. The thing that also needs to be added to this conversation is, internationally, physiotherapy is much more recognized and has much more of a standing. And so, like, if you go to, I was in Spain recently, they don't have EPs. There's no such thing as an EP.
Yeah.
So the qualification has, again, it's power. It has more standing, has more recognition, has more medico-legal power. You can work in the UK as a physio. It's possible to work as an EP, but they're in like very specific, I think, cardiac rehab kind of hospital settings. They don't work as, there's not as many. You can't work in the NHS. Oh, I think it's just much harder to work overseas compared to physiotherapy. So they'd have a lot more international students coming in who would
Mhm.
be investing lots of money to get an Australian physiotherapy degree. And that's worth a lot more within the healthcare global kind of economic and political systems.
I agree.
yeah, we've got that tutor Victor. She's a Kiwi lady, and she runs a EP clinic in New Zealand.
Yeah,
And
in New
we were
Zealand.
talking to her about, we asked her this same question about, what is an EP, because we wanted to know if this is a while ago. And she said, like, she brought it up to us that EP in New Zealand is like, even in New Zealand, it's barely known. Like, what was it, Victor? She said like the amount of registered EPs in New Zealand is, I
Less
can't
than
remember the
100.
number, but it was very
Less than
low. Yeah,
100.
it was. And then she said Australia, that's why she's in Australia, because Australia is like leading it.
Something like that,
Like,
yeah.
yeah, we've got some of the highest numbers, I think, which is good to hear for us. But yeah, definitely in terms of coverage around
Yeah,
the
and
world, it's a lot less than physio.
I think, and I mean, it's not like we travel to New Zealand and the evidence suddenly turns into like a Kiwi accent and it's different. So I think if we're all kind of going along the lines and trying to evolve according to what our knowledge is of the things that we're helping and the people that we're treating, then we should be evolving, we should be changing. And so hopefully, if we're being evidence-based, if I go to Spain and I'm injured, I should theoretically be treated kind of similarly, maybe not exactly the same, but kind of similarly to if I got injured in Sydney.
Yeah, evidence has no
That's really hopeful.
language.
No, definitely not.
So that's probably a whole podcast episode, but did that cover like maybe a starting points for students from what you've heard?
Yes,
Yeah, I think
definitely. That was amazing.
Definitely. Yeah. Right.
Okay,
Daniel,
so
do you have any questions for us?
yeah, Dan.
Oh yeah, it's my turn. Exciting. So I'm curious. Maybe we'll start with you, Victor. Put you on the spot. So first of all, I wanted to also like shout out to all the efforts that you put in online content. I think you're hopefully role modeling the putting out the information, because I think I had a story in my head when I was a student that I'm just a student. I don't know enough. And you're like fucking challenging that. And that's amazing. I think we need more promotion of just content, of just good, high quality content. And also being okay to like put out content that is wrong. Because I've put out a lot of content where I look back and I'm like, oh my God, I said that. But at least I was putting it out. I think it's important to drown out the misinformation that's out there, and also to just role model that students actually can have some expertise and knowledge. It's not just based on your experience. So rant aside, for you, what were your biggest takeaways from the 2 or 3 sessions now you've shadowed with EPs? Maybe like what were you expecting to see and what did you see?
Okay, so before I get started, I think that there should be some sort of this should be a staple part of any uni degree. From the get-go, you should be put in a situation where you can see what the end goal can look like and see if it's number one for you or the options that are available. And I feel like that should be something that's established maybe in the future. So my expectations coming into it was I had no clue really as to what the encounter was going to be like. I didn't know whether I didn't know much about the history of the patient. I didn't know what type of exercises we would be doing, stuff like that. The specifics, I could just envision ourselves in a gym, but beyond that, there was so much that I had no idea about. And then as I had the first session and then the second session, I guess it demystified what role an EP could play for a patient. And so I have a list of just a few things I've learned. So one big one is I didn't realize the personal connection you can make with clients. That is something that I pretty much ignored or just overlooked maybe, because we're learning about the body or anatomy, all these things, biomechanics, but then you overlook that at the end of the day, it is a patient, it is a person. And then it is, you are having conversations with them. It's not just a robot. So that part really stuck out to me, that maybe so far in my uni degree, I wasn't prepared for. So just, yeah, the deep connections you can make. And it's almost like as if you're friends, right? You're just going, helping them exercise, having a chat, and it's really a fun environment. Another thing is the use of RPE would really surprise me, because I knew about RPE, obviously, but I've never thought about it in the way that you've implemented it. So like usually I'll just do reps and sets, and I need to hit this rep, and you keep going until it's sore and whatever. And I'm sure a lot of people can resonate with that. But having that RPE system, even though I'd learnt about it, I didn't know it could be used in that way. So not going all the way to failure, a 10 could be breaking down a form. It doesn't have to be you're dying and shaking and that sort of thing. Absolutely not. And managing the weight to accommodate what feels like a 7, what feels like an 8. It's just a different perspective that I had no idea about, and it really opened my mind to the way which we can train. And I prefer RPE way more than just having a set reps and set scheme. And then last thing before I go too much of a tangent is I didn't realize the amount of sort of multitasking and the things you have to have in the back of your mind as you're dealing with the client. So yes, you're talking to the client, you're talking about how their day was, their kids, etc. But then you're also thinking about the rest you have left. What exercises are next? How much load we're going to have to do for that? How much time do we have left in the session? All these things, it's a skill that you'll develop over time, but I had no idea about that either. So there's a lot of things that I learned, and I think it's really benefited me in knowing what it's going to be like coming out of this degree. So thank you.
Awesome. That's cool. And I agree that we need to see more examples. I think why not in first year? The examples reflecting on my uni experience, that the examples that I had was with my own injuries and seeing how other physios treated me as like a patient. I'm curious, Henry, have you had the opportunity to see EPs or other like allied health professionals?
Yeah, well, I haven't during the uni degree, as in this year. I definitely think they should, like after hearing that from Victor, it's brought up a good point in my head that they should incorporate some form of exposure to that professional environment, because really people need to see the reality of what it is and what you can expect, so then they can have an understanding whether to continue or what they like about it, all that sort of stuff. But yeah, for me personally, my experiences are probably more unique than the average person. Obviously, I'm a soccer player as well as yourself. So I've had, my fair share of injuries and problems, and I've been exposed to a lot of health professionals, which really is what drove my passion to study EP, things like that. So for me, like, I've seen physios, sport doctors, you name it, everything. And so even though it's not an EP, I've had exposure to a similar area, which has definitely given me some sort of understanding on grounding. But specifically an EP would also be really good to see in the first year.
Yeah, that's awesome. And the experiences that you've already had can be things that you can draw upon in future, whether you choose in like to go into EP or to physio or to anything. I think we all have our own prior experiences that shape our expectations. So now, like Victor, for your expectations, it'll be interesting for you to see someone else that maybe works in a different way, even though their title is an EP. So I think it's important for all of us to like have our own reflections on what are our experiences as clients, as patients. If we've had injuries before, if we've seen physios, doctors, chiros, osteos, podiatrists before, and what do we take from those experiences? And then can we see some examples? Can we see, or how do you practice? Like asking maybe tutors, because I know a lot of them do practice, and there's a wealth of information and knowledge that you can just gain from like what's your everyday work life like? What kind of population do you see? And yeah, there's a few videos as well out there that I found helpful. I think a few on YouTube, and if anyone's interested, I can shoot through a few links of like some of my patient demonstrations so you can see what it's like, see what the interactions are like. Because otherwise you'd get stuck maybe in a degree and you had an idea that it would be maybe more technical or maybe more like laboratory based or more like objective, and this is like the exact biomechanical angle and this is how we're going to measure it. Maybe that's more sports science. So had you not known that, you would have wasted your time doing a degree maybe that is not really how you want to be working. So yeah, seeing examples helps us see how the theory that we're learning is then applied.
Yeah, well, that especially from my experience as well, like when I was looking at what degree to choose out of these health science degrees. Personally, in my opinion, the video Sydney Uni provides, that quick, short, and brief video for an undergrad student, coming out of high school, everyone's seen that video, and you look at it, and I remember watching it the first time, being like, okay, I think I know, and then a few days later, I'd be like, wait, hold on a sec, and like I'd go back, but it wouldn't provide me with any actual clarity on what it is. It's a very vague and brief video that I think they need to sort of
Update.
change or look into a different. Even like having an interview with an EP as the video would be way more valuable, because then EP can physically explain.
Yes.
And yeah, I think that needs to be changed.
And going back on my experience when I first saw that video, to be honest, it deterred me from EP because when I was in 11, 12, I saw EP was a degree. I was looking at the health science degrees. I saw EP. I looked at the video, and then I saw um, like the patient treating a fat person with the blood pressure monitor and then making them exercise. And it did not, I thought that's all they did. That was a day in the average day in the life, that sort of thing, day in, day out. It wasn't for me. So for a few months, I said, no, definitely not doing EP. And I was going more into the sports science route. So yeah, if it wasn't for the fact that I did get the ATAR that I get, plus then I found out EP and sports science did have the same accreditation anyway. So you might as well just do EP. That if it wasn't for that, then maybe I would still be in a sports science degree, which I think, yeah, just that one video is weird to think about how much power that holds for the future generations even.
So much power, like that's that's the base of a lot of decisions, I think, for students in our degree, and that's pretty sad, to be honest.
Yeah. So yeah, I agree. Interviews with clinicians and seeing more videos of maybe how they practice, like a 2-minute snapshot into their clinic and how they work with different people. Because yeah, that video had all the stereotypes. Would not recommend that video to students.